Hello and welcome to In Case You Missed It. This is what's happening in healthcare. So, we have got four Democratic led states suing the Trump administration over the rescission of more than $600 million in public health grants. The administration is saying that these grants have been rescinded because they know they're terminated because they no longer reflect the priorities of this administration and the agencies that were funding them. So, these states are Colorado, Illinois, California, Minnesota. Again, over 600 million. This is part of a $1.5 billion cut, 600 million for healthcare. And the cuts are a little disturbing because they're following right into line with the removal of all these DEI priorities. So some of the highlighted cuts they're talking about are COVID-19 disparities among minorities, HIV issues and use issues amongst cisgender Black women. So they're falling really, really into the lines of the DEI stuff and politics and policy. Those that are the states that are suing them claim that these violate the Administrative Procedures Act, the 10th Amendment, the separation of powers, and the spending clause. My guess is we see these funds restored, but not before we're missing out on them for many, many months, and who knows what kind of impact that'll have. And here's some really big news, and I hope you're all sitting down because we have a bipartisan proposal. So Senators Elizabeth Warren from Massachusetts and Josh Hawley from Missouri are teaming up to break up big medicine. So the lawmakers introduced a crackdown on healthcare conglomerates that own multiple parts of the industries, including pharmacy benefit managers. PBMs, this is going to be a term you're going to be hearing a lot about in the next couple of years. So Warren and Hawley's Break Up Big Medicine Act proposes to prohibit parent companies from owning the medical provider, the management services organization, the PBM, the insurer, or even prescription drug or medical device wholesalers owning medical providers, management services organizations. So what we've been seeing is that these big insurance companies and the parent companies of them are buying up all the verticals within the healthcare space, and then now raising prices is on everybody's best interest, not ours, of course, but everybody's best interest within the companies. So speaking of pharmacy benefit managers, you want to know how bad the problem is? There are three PBMs, CVS Caremark, Express Scripts, and Optum Rx, that manage 79% of the prescription drug claims for roughly 270 million people in the US. So this is according to a 2024 report. This is way too much concentration of that. There is all kinds of tomfoolery going on with prescription drugs. And those three companies we named are part of giant CVS Health. That's the Aetna brand. Aetna is under that CVS Health brand. Cigna and United Health Group. Those three insurance companies by themselves insure hundreds of millions of people in this country. This law is drawing parallels to the Glass-Steagall Act of 1932, which effectively separated the commercial banking industry from the investment banking industry. So big news here, and frankly, kind of rooting for this to happen because this is a real answer to some of the affordability issues. Staying with DC, we've got another subpoena from the House for health insurance companies. You remember a couple of weeks ago, the big five of the biggest insurance companies were summoned to DC to testify on the unaffordability of healthcare. We are back at it. There has been a subpoena for 8 health insurance companies as information in part on how ACA subsidies have been applied through the marketplace. So when there are ACA subsidies, these are taxpayer dollars sent directly to the insurance company. And what the real focus is in on insured policies where they paid zero premium and there was zero utilization throughout the year. So, of course, just because you didn't use your health plan doesn't mean there's been fraud committed. But what they're looking at and what they are insinuating is that insurance companies were complicit in helping people enroll members that had no idea they had insurance so that they could collect ACA tax subsidies. Okay, so there's a February 23rd deadline for them to submit all the documentation. So the biggest players in the industry are here. It's Blue Shield of California, Centene Corporation, which HealthNet is one of the brand names you'd hear under the Centene Corporation, CVS Health, that would be Aetna, Elevance Health, that's Anthem Blue Cross Blue Shield, Guidewell Healthcare Services Corporation, Kaiser Permanente, and Oscar. These are the ones on the receiving end of these subpoenas. They have until February 23rd to distribute this information. And again, specifically focusing on enrolled insured members that had zero claims, that also had zero premium asked of them. All right, all eyes on the GOP and the internal fighting happening right now. We have more than 50 conservative leaders that signed a letter against Trump's most favored nation pricing for prescription drugs. As a reminder, what that is, just saying if you charge Europe $5 for this drug, charge us $5, not $500. Seems to be a pretty rational thing. But those that sign the letter, in the letter, they say Trump is trying to import socialist price controls and values into our country. Seems a little dramatic. Seems like some of the words from the big pharma lobby, which is a very powerful lobby in DC. And it really highlights the growing tension between Trump and a portion of the conservative movement. So one of the things that this letter said is that if the U.S. implements the same price controls utilized by foreign governments, it is going to depress the prices. These big pharma companies are not going to be able to recuperate the dollars that they're spending on research and development. It's going to depress innovation. It's going to reduce cures and maybe even lead to unacceptable drug shortages. Now, again, this is a lot of noise coming from very, very likely lobbyists that don't want to see the prescription drug prices go down. But right now, 25% of your healthcare premium is just prescription drugs. So I think we can stand to lower the prices there a little bit. And our last story, GLP-1 drugs. We're starting to see some evidence of scurvy popping up with people that are using this. So that old 17th and 18th century disease that was ravaging, considered rare in developed nations, but ravaging other areas. We are now seeing people that are using Ozempic and Wegovy being diagnosed with scurvy. So very uncommon, something we haven't seen in a couple hundred years in mass, but we'll keep our eye on it. Thanks so much. See you next week.